Hi, so I'm going to be talking about sleep and traumatic brain injuries in student athletes. So, this is the overview of what I'll be discussing today. In terms of the topic, sleep in athletes, sleep is a bit of a crisis in student athletes. Um, it's reasonable to assume that student athletes need to sleep more than the average individual due to meet the demands of their practices and recovery. But actually, student athletes are consistently getting less than 7 hours of sleep per night. Studies across multiple D1 programs show that 40 to 80% of athletes report poor sleep quality and insufficient sleep, especially before and after competition. This impacts both short term and performance and long term health. Sleep deprivation in athletes is often caused by travel, training, or competition schedules, caffeine intake, and non sports specific factors like family, work, social obligations, and lifestyle factors. The lack of rest overall impacts everything from performance, recovery, to safety. In terms of the scope of the problem is extremely widespread. Collegiate athletes often suffer from insomnia and sleep disturbances, especially with with a history of a concussion. Over 1.6 million sports related concussions occur each year, and these directly worsen sleep outcomes, with concussions being linked to 3 times higher risk of insomnia. For historical context, the issue really isn't new. Dr. Thomas Riley published the first study on athletes and sleep in 1981. But it's only recently that we've seen an explosion in research, as 80% of relevant studies have been published since 2010, showing that we're just beginning to understand how vital sleep is for performance and health. Yet, despite this, most programs still don't reflect what we know about effective sleep interventions. And despite this growing amount of research, there's still limited practical change and long-term behavioral outcomes. So, the health and safety consequences of poor sleep in an athlete population are pretty serious. Physiologically, sleep deprivation increases resting heart rate, oxygen uptake, resting carbon dioxide production, and lactate production during exercise. It also raises injury risk, reduces endurance and coordination, and impairs metabolism. There's also decreased cardiorespiratory endurance, neuromotor performance, mood, concentration, and metabolism, as I previously mentioned. And just one night of poor sleep can increase anxiety and worsen reaction times. Also, body temperature peaks in late afternoon, improving VO2 max and muscle performance, meaning circadian timing really matters for competition. In terms of cognitive effects, as I mentioned, it negatively affects memory, slows down learning and reaction time, and can heighten anxiety and stress levels, as well as increasing risk for depression, which I'll talk about later. In the long term, there's an increased risk for cardiovascular disease and an increased risk for obesity and diabetes through sleep deprivation's effect on metabolism, as discussed in lecture. And honestly, it's not just physical. Sleep loss also has major effects on mental health and society as a whole. Um, Difficulty falling asleep, staying asleep, sleeping too long, or waking too early are known to be symptoms of depression, bipolar disorder, and ADHD. And each night of insufficient sleep, the risk of depression, anxiety, and even suicidal thoughts increases by over 20%. Combine that with the pressure to perform, travel, and academics, it's no surprise that student athletes are struggling, as we've noticed decreased academic and athletic performance, especially in adolescence, um, when sleep deprived. Like I said, this is a major issue for student athletes managing academic and athletic stress, which not only costs the individual but also institutions and healthcare systems. Interventions like a 90-minute education sessions, wearables, and daily sleep tracking help, but long-lasting behavioral change is hard to maintain. And few programs include cognitive behavioral therapy for insomnia, or CBTI, which is the gold standard for chronic insomnia and evidence-based and effective. And that's a major missed opportunity. Like I said in this slide, we see moderate improvements with education sessions, but behavioral change is really difficult. And one of those ways we can see behavioral change is through CBTI. In terms of concussions, it's really hard to detect and report concussions because athletes are often deterred from reporting due to their desire to play. And in general, it's just difficult to change behaviors with solely an educational intervention if it's not based in societal patterns and behaviors, as well as accountability. So, as a result, my solution is an 8-step comprehensive intervention focused on athletes with past concussions. It starts with intake surveys and education on sleep hygiene, as well as a sleep screening in order to determine if there's already existing conditions. Then, CBTI will be introduced, supported by sleep tracking, daily text reminders, and weekly incentives. Athletes will also have access to peer groups and support staff 24/7, and we will refer them to specialists if needed. There are two major barriers here. First is behavioral change. We'll address that in my intervention by combining peer support with financial incentives. Second, many athletes avoid reporting concussions and have a tendency to hide them in order to keep playing. To counter this, the program will emphasize the long-term risks of untreated traumatic brain injuries and encourage early disclosure as to not develop CTE, which is a neurodegenerative disease linked to repeated trauma to the head. With this approach, we expect better sleep, fewer symptoms, and improved performance. More importantly, I really hope to protect athletes' mental health, long-term well-being, and overall quality of life. Here's my works cited, and thank you for listening.